Ms. Tenney.
Thank you, Mr. Chairman, and thank you to the panel for being here. I know it's been a long day. Everybody's heard this, but I'm also a small business owner like Ms. Miller, but you know, Americans are paying more and more for health insurance and they're getting less in return. Higher premiums, high deductibles, I can speak for that myself, narrower networks, fewer doctors, and for the small businesses, there are fewer options and competitiveness. It's been 15 years since Obamacare became law, and the results are clear. The premiums continue to go up. By the way, at exponential rates. I know the Democrats want to say they were already going up, but I can see the huge difference just from 2010 into now, you know, from hundreds to thousands more each year. And the insurers, and I'm just going to be honest, seem to be rewarded for price increases at the expense of the families and taxpayers. That's not market competition, and that's what we're looking for. This is a government-driven inflation in healthcare, and more about healthcare really than it is about getting better medical outcomes. Meanwhile, as I said, small businesses who try to do the right thing, provide healthcare for their families like we do in our rural area in upstate New York, we're priced out. And I come from New York, and I have to say that no state is more reflective of the systemic failure than the state of New York, which now holds the #1 spot for the highest employer-sponsored coverage premiums in the nation. And I'll just, you know, from a personal example, I was just talking to my brother who runs our company. $36,000 a year for a family plan, and $16,000 of that we have to self-insure because we just simply can't afford it in rural upstate New York. $19,000 for a single plan. 8,000 of that is self-insured. So we take the risk as a business. It could wipe us out with a catastrophic injury. So this is the kind of stuff that small businesses are being forced to be in. And I know Ms. Moore talked about small businesses. Well, she said 89% of the people in her communities or in the country go to work in a small business. But in my district, it's 95% of the workers go to a small business. We just don't have any options, and we have to provide health care because we have over 50 employees, so we have to comply with the Health Care Act. But I want to talk about the role of consolidation and vertical integration and kind of go down a similar path that Ms. Miller went down. And I hate to keep picking on you, Mr. Hemsley, but you're from United Health, so I think you can take it. Look, you have obviously, you know, the largest, most prolific healthcare provider, healthcare insurance company, maybe, and the nation's. This concerns me. The nation's largest employer of physicians. Why is that insurance company employing physicians? Shouldn't that be separate? And one of the big three PBMs, pharmacy benefit managers, to name a few businesses, all vertically integrated, and a very robust portfolio. But let's say I enroll in one of your Obamacare plans through the individual marketplace with an 80% medical loss ratio. The MLR is calculated at the insurance entity level, not at the consolidated parent level. Is that correct?
It's calculated at the legal entity level, I believe.
So is that the same thing as a consolidated parent company level? So that would be your parent, the legal. When you say legal, anything, you know, that's sort of a ubiquitous term.
It's hard to respond to what I would.
So let me see if I can go to this. So when when United Healthcare contracts with Optum Rx, which is your PBM, right? Mm-hmm. To manage my prescriptions, that payment counts as medical spending under the MLR, is that correct?
Yes.
Okay, so when Optum Rx negotiates manufacturer rebates on prescription drugs, reducing the net cost of the drug, right?
We do, yes.
Okay, and so our manufacturer rebates negotiated by Optum Rx on behalf of United Healthcare pass through to the insurance entity before the medical loss ratio is calculated.
The costs do pass through to the benefit in the insurance company.
So that should lower premiums, right? Because we're passing that cost through.
And does, because we get the lowest price possible.
Okay, so is it possible that these rebates negotiated by Optum Rx are retained at the PBM level or allocated elsewhere in the corporate structure?
No, they are passed through.
So purposes of doing the MLR premium calculation, where are we with there? So is that we're really just kind of using within entities, so we're really not reducing the cost to I know this is complicated, we're really not reducing the cost to individuals. No, we're sort of moving throughout the corporate structure to get to meet the MLR requirement, but still costing more via the PBM to the patients.
So everything that you are addressing really is very intensely regulated. So there is great oversight over the arrangements.
So let me, if it's intensely regulated, I'm a member of Congress. What can I do to make sure those rates get reduced? So a vertical integration bill on PBMs for a company like yours, would that be something that would help reduce that rate so that we get more transparency and a lower rate to our consumers? Because PBMs don't really work great in my district because I have mostly locally owned and operated pharmacies. I don't have CVS. I don't have big vertically integrated. So for us, I'm out of time, but I wonder if you could just answer that quickly. Don't you think we need to address that vertical integration? And I know that's a hard question for you to ask. It's part of your portfolio. Is there a way that we can fix that so that it brings the cost down?
I think if I could offer that there is a great deal of oversight and regulation already at the state insurance levels and at the federal levels to make sure that what you're suggesting does not happen. And if you look at an organization like United Health Group, across all the discussion about all the elements and so forth, our net margin is 5%. So there is no...
In which entity? Because you have all these multiple entities when we go back to the medical loss determination.
We're going to have to wrap up.
My time's expired. I thank you. Appreciate it.
Thank you. Ms. Beth